The AUGMENT study is a clinical trial. It's a randomized Phase III double-blind, placebo-controlled study looking at patients with recurrent indolent lymphoma, both follicular and marginal zone lymphoma. These were patients that had recurrent disease after prior therapy. These patients were randomized to either receive Rituximab weekly times 4 plus 4 monthly infusions that followed, plus Lenalidomide, 20 milligram dosing, 3 out of every 4 weeks for 12 months or 12 cycles. So that was the experimental arm. The control arm received Rituximab and placebo. So the main findings of the study with regard to safety were that, as expected, there was a bit more toxicity, a few more side effects with the combination arm, particularly with respect to neutropenia, grade 3-4 neutropenia, as well as grade 1-2 infections, rash, and constipation, as well as tumor flare being the most different between the two arms. On the other hand, and perhaps more importantly, the efficacy was significantly greater with the lenalidomide rituximab arm, showing that the progression-free survival, which was a primary endpoint, was 39 months versus 14 months. This progression-free survival was associated with an improvement in overall response rate, roughly 75% versus 50%, as well as an improvement in complete response rate. Finally, there was, in the follicular lymphoma subgroup, there was an overall survival benefit to patients receiving lenalidomide plus rituximab. And so I think that this is a regimen that offers significant efficacy advantages, and in the context of the safety profile is something that many patients going forward with relapsed and refractory follicular lymphoma will consider as a potential therapy.